Okay. Hi, my name is Michael Toos. I've lived in this area probably about 28 years, and I think in all that time I've been coming to this dental practice. It's always been a busy practice, but in fact it was taken over a couple of years ago by a new dentist called Shai Kareem, and the facilities have been extended considerably, and it actually looks smarter than it used to look. So I'm clearly very happy about continuing to come. A few months ago I had a problem with a tooth. It cracked and I had to have it extracted. It couldn't be saved. And I then had to face the alternatives of the different types of treatment. One was a crown, which I wasn't particularly keen on because it sort of meant interfering with other teeth. Another was to put in a palate, which it meant taking it in, taking it out from time to time, and all the cleaning issues. And the third option, the one I went with, was the implant, which is a one-off treatment, and when it's done, and it's done for life in effect. So I'm just telling you about this implant side and my experience, which was good as far as I'm concerned. It was very simple. I went, I think, 3 times altogether. The first time was have the implant, I think it's called an abutment, put in. It's like a little titanium piece of metal that was inserted in the my upper jaw, and the process was not dissimilar to an ordinary filling, perhaps 50% longer. No real pain experience. I had a local anaesthetic, as you would do for a filling, and I think it was a simple process. I have to say it was done by an expert, a chap called Richard Brookshaw, and he clearly knew what he was doing, and I felt in very good hands. So this was done. I had to wait a few weeks and go back when it had settled down. I didn't really feel any discomfort. Nevertheless, I waited the requisite number of weeks. I went back, and I think there was a little cap on the top that was taken off, and a little post was put in to mimic the effects of having a crown, and an implant was taken. In fact, if there was any part of the process I didn't like, it was having the implant, the impression taken of my teeth. That's just something I don't particularly like. But again, it was quite painless. That was then taken out again, and Richard Brookshaw went and took the implant and had I need to stop at this point.
Crown.
The actual crown was made to look like my other teeth. I went back and this was put on. It's a perfect match. It looks and feels just like the rest of my teeth. I think the only difference is it doesn't have a filling, but other than that it's exactly the same. I would say it's just part of me really now. I don't notice that I don't notice the difference. What I do notice is I can use my teeth and I can chew very well on both sides, and the implant side is as good, if not better, than the other. So to me it's a perfect solution, and I think I would recommend it. Clearly there's a cost involved, but I would recommend it to other people.